the state anthem. Thank you so much. We can have a seat. Yes, the pace setter will lead all the follows in Oyo State. With the permission of Right Honorable Speaker, Edward Adebo Ogudoyi. Health. You are welcome, sir. We have the leaders of the House representing the Speaker, other members of the committee. You are welcome, sir. I need to remind us that this program, Prevention and Regulation Bill 2025, is jointly organized by the Standing House Committee on Health of the Committee on Women Affairs, which will join us. But here this morning, I have the chairman of the Health Committee and other members of this 10th Assembly. They are here. They've prepared for us to tell us briefly what we have in those documents that we have already submitted. Quickly, I will go into the introduction now. And the first person I would like to introduce on health, the chairman, the Standing Committee on Health, Honorable Rewan Saminu Gbadamosi. You are welcome. We have the representative of the Right Honorable Speaker, though he's a busy man. He's already on another assignment. He wants to attend to a very important program, but will still join us. He's the leader of the House, Honorable Sojo Adejoyi. You are welcome, sir. Thank you so much. Thank you so much, sir. Also, I quickly want to introduce to us, before I go back to the high table, the lawmaker representing Orire State constituency. I know when we had Orire, we know that this man, by now, should be up and down. Honorable Ogundele, you're welcome, sir. The Lord will be with you. I want to go back to the high table. We have our Lord. Thank you so much for joining us. And not say on my introduction at the high table, now is the lawmaker man. You are welcome, sir. Once again, we apologize for starting behind the schedule. We want to make this program as quick as possible with our cooperation so that we can attend to so many other things. We have our memorandum with us. I want to invite to the microphone now the man with the honors, the responsibility of this committee on health that has worked hand in hand to ensure that this public hearing comes to.
Good morning, everyone. Good morning. Yeah, Shedu. And on behalf of Right Honorable Speaker, Right Honorable Edward Adebo Ogundoyi, we sincerely apologize for coming late behind the schedule. I welcome everybody this morning. Opening remark by the Chairman, Committee on Health, Oyo State House of Assembly, at the public hearing on the Oyo State Unplanned Pregnancy and Unsafe Abortion Prevention and Regulation Bill. Chairman, Primary Education. No, not you. Honorable Anthony, I recognize you. Honorable Longpoto and Dear Dami, I recognize everyone here present. Protocol. It is my pleasure to welcome you all to this public hearing on the Oyo State Unplanned Pregnancy and Unsafe Abortion Prevention and Regulation Bill 2025 on behalf of the Oyo State House of Assembly and the House Committee on Health. I sincerely appreciate all the stakeholders, development partner, professional body, civil society organization, religion institution, traditional leader, women and youth groups, and members of the public who have taken time to participate in this important exercise. I welcome everybody. Your presence here today demonstrates our shared commitment to improve the health and well-being of the people of Oyo State. The issue across the world and Nigeria is not exempt. Every year, many young girls and women face unplanned life and future aspiration. In many cases, fear, stigma, lack and information, poverty and intervention, education and support system. This bill is therefore intended to provide a framework for prevention, awareness, education, counseling, support service, regulation, and appropriate monitoring mechanism aimed to reduce the incidence of unplanned pregnancy and unsafe abortion. As a legislator,
and I would like to especially appreciate these following people. The health chairperson, Mothers on Mission leader, Anglican Church, Yahweh School Worship, Pentecostal IN, Saruddin Society, PSN, ACPN, Ministry of Women Affairs Representative, Bureau of Statistics Agency, NCCDC, WHO, Plant Foundation, Center for Bridging Health Communication, Plant Periodic, Policy and Advocacy Major, Youth Care Development and Empowerment, Light Up for the Blind, ADH Headline RNC Foundation, ASWHAN Foundation, Community Leaders Represent, God's Treasured Kiddies Initiatives, NANNN Oyo State, PMTCT, APVIN, WARDC, Visual Spirit Initiatives, and others. We welcome you to this special program. You're all welcome. And in my introduction, I want to welcome and introduce to us the Director, Planning Research and Statistics in Oyo State House of Assembly, Mr. Maruf Agbola. You are welcome. Thank you so much for joining us. You are welcome. I also want to welcome people from my own constituency. Yes, I represent a constituency in Oyo State House of Assembly. Gentlemen of the press, you are welcome to this program. Thank you so much for preparing yourself. The next on our agenda is well, by now we'll go quickly to the overview of the bill. I want to call on the committee clerk, Mr. Sodiq. There are other items on our agenda, but we have to reschedule them. We have to visit them one by one after the other. I want to call on the committee clerk, Mr. Sodiq Olayoju, to give us the brief, everything that has to do with this bill, so that we can have the depth understanding of.
On behalf of the Right Honourable Speaker, honourable members here seated, permanent secretaries, representative of organizations here seated, civil society organizations, international organizations, you are highly welcome to Oyo State House of Assembly. My name is Olayonju, an Unsafe Abortion Prevention and Regulation Bill 2025. And when I'm told that I'm particularly going to do this, I've been thinking, how would I go about it? Because I know that there are many people here who have come with a notion that perhaps the assembly is about to legalize abortion. Many people will be here who will be thinking, what are they doing? Are they here to legalize abortion? Well, if you have come with that notion, I'm very sorry you may. I want to say that when we look around our society, we see a lot of things happening. I was at Iwo Road one day, and I saw about five thinking, what happened? Where did we get it wrong? Our traditional society, Fran even had you female mingling with men. If you are disflowered before marriage, there is a consequence for it. We understand how our society frown on about abortion. I'm a religious man as well. We have religious people also here. Even if I don't know what the Bible says about abortion, I quite know what the Quran says about it. Yet, we see these things happening around us every now and then. And what can we do? And briefly, objective of this bill. So it is against this backdrop that the bill before us seeks to address or achieve 6 major objectives. First, it aims to prevent unplanned pregnancies through comprehensive sexual and reproductive health education, awareness programs, and access to family planning information. You can see these in subclauses 4A, 4F, and clause 15 of this bill. Secondly, this bill also seeks to protect lives and deaths of women by addressing circumstances that often expose them to clauses 5, subclause 1A and B, address what I have talked about. You will agree with me that even if we are not talking about this, it is happening everywhere. Everywhere. At the corner of our town, in our cities, and every other place. Every day we have our young girls, our women fall into the hands of, I cannot even call them quack doctors. They are not even quack doctors. People who do not even have anything to do with medicine and surgery at all, carrying out this abortion of the thing. So I think it is important that we address that. Third, this bill establishes a legal and regulatory framework for handling exceptional cases involving pregnancy resulting from rape, incest, reproductive exploitation, severe fetal abnormality, or situation where a woman's life or health is at serious risk. During one of the meetings that I was present with, I attended with Planned Foundation, we had a story of a woman who was raped, and eventually he gave back to the child. But instead of this child becoming a source of joy to her, whenever he sees this child, she becomes very riled up. She has psychological problem. So she doesn't want to see her. How do we go about this? I also heard a story of a woman when she was scanned, there was the baby does not have head. About it. But this bill also comes with counseling, education. I have also heard about a story of a girl, a teenage girl that was impregnated. But through organization like Planned Foundation, this girl was advised that even if you have this, you can go through your education and become somebody in life. She was supported. That is one of the things that inspires me and that should inspire some other people about the concern of the assembly on this bill. The fourth thing, including mandatory counseling informed consent, medical certification, confidentiality requirements, professional oversight, and sanction against coercion or abuse. You will find this in clause 6, clause 7, including subclause 7, 6, clause 12, clause 13, and clause 16. The fifth one is that this bill provides special protection for minors, survivors of sexual violence, and other vulnerable persons by ensuring access to psychosocial support, legal protection, and appropriate health care services. You find this in subclause 7, 4, clause 8, including clause 8, 3, clause 9, clause 10, and clause 17. Finally, this bill creates institutional mechanism for monitoring, accountability, reporting, continuous review through the establishment of multidisciplinary monitoring committee and the oversight role of Ministry of Health. Clause 3, clause 18, clause 19, and clause 20 address what I've talked about. It is important to emphasize that this bill places significant responsibility on healthcare professionals and facilities, ensuring that any action taken under the law is guided by professional ethics, professional standards. It's an opportunity for all stakeholders, medical practitioners, religious leaders, traditional institutions, civil society organizations, legal experts, women groups, youth representatives, and members of the public to critically examine the provisions of the bill and make valuable contributions that will enrich the legislative process. The purpose of this hearing is not merely to discuss bill, but to collectively seek solution to a problem of our society. We look forward to constructive, evidence-based, and respectful contributions.
Done so well to ensure that every definition, every terminologies that we might come across on that bill has been explained to us. Thank you so much. Please, let's put your hands together for him once again. During his presentation, some important personnel joined us, and the first person I would like to meet, yes, that is an advocate for this special agenda. Also, we have in the midst Honorable Benga George, the candidate APM in Kajala. Please come to the high table. The Honorable Commissioner for Youth and Sports, Honorable Benga George, please come to the high table. And also Barrister Bankole Adekule, the former chairman of Orire Local Government, please welcome to the table. Yes, I deliberately want to introduce and welcome this very fantastic lawmaker in Oyo State 10th Assembly, the Chairman's Committee on Women Affairs. Sorry, she just joined us. Yes, it's all about our agenda. Very, very important. I want to welcome to our midst and introduce to us Honorable Mrs. Osi Olajide. Let's put our hands together for she's representing Ibadan North State Constituency. She has assignments for us now. We give us goodwill message. I want to invite her to the microphone for her. She's training. You're welcome, ma'am.
Good morning, distinguished members seated. The Chairman House Committee on Health, all my wonderful distinguished in the House of Assembly, good morning. Chairman UNPLANNED Foundation, good morning to you. The commissioners here present, the chairman local government presence here, and all the distinguished. I call you the distinguished because we are all important. Good morning to you. Permit me to also stand on other existing protocol. My goodwill message. I'm Honorable Olufunke Comforter Olajide, Chairman House Committee on Women Affairs and Community Development. And today's public hearing on the Oyo State Unplanned Pregnancy and Unsafe Abortion, that is, prevention and regulation of this bill. How do we prevent it? I am delighted to welcome all stakeholders to this important public hearing on this Oyo State Unplanned Pregnancy and Unsafe Abortion, Prevention and Regulation Bill 2025. As a woman and a mother and a chairman of the House Committee on Women Affairs and Community Development, I'm particularly concerned about the realities faced by many young girls and women who find themselves confronted with unplanned pregnancy, often under difficult circumstances. Beyond the health implication, these situations affect education, economy, opportunities, emotion, well-being, family stability, and the overall development intervention that protects lives, preserves dignity, and promotes the welfare of women and families in the community. On behalf of the Committee on Women Affairs and Community Development and Oyo State House of Assembly, I appreciate your presence and invaluable contribution. I am confident that today's deliberation will enrich the process and contribute meaningfully to the development of healthy and more prosperous Oyo State. Thank you all, and God bless you. Once again, I want to apologize for coming a bit behind schedule. Thank you for your understanding.
Please, we can do better. Let us appreciate the chairman. House Committee on Women Affairs, thank you so much. I would like to recognize some people here. And we're very sorry for this lateness. Please pardon us. The Permanent Secretary, Minister of Health, Dr. A.K. Ayinde. Good afternoon, sir. You're welcome, sir. Also, we have the Permanent Secretary, Hospital Management Board, Dr. Mrs. Ibrahim. Please, the Permanent Secretary, kindly come to the high table. Please, you're invited to the high table with the permission of the chairman. You're welcome to the high table. We want to recognize the Solicitor General, the Permanent Secretary, Minister of Justice, Barrister Oluwabumi Are. You are welcome, ma'am. Please come to the high table. Also, all the directors from both Ministry of Health and Hospital Management Board, you are welcome to this gathering. We welcome the Provost School of Nursing, Dr. Gbojubola Owolabi. You are welcome, and I want to appreciate our interpreter for the hearing in Mr. Korede Olulaye. You are welcome. And with the kind permission of the chairman, I want the Commissioner of Youth and Sport to please come to the high table. Please come to the high table. Please let's put our hands together for the presentation of a memorandum. Please, when we get to this place, we would like us to first introduce ourselves. Our name is very, very important for documentation and for news purpose. We introduce ourselves.
The ministry concerns about the bill. But I want to tell you that unsafe abortion remains a significant public health issue globally and contributes about 40% to maternal mortality. The previous 11%, it means that the data on unsafe abortion was not well documented because of the circumstances. But let's look at the bill a little bit. However, after reviewing the bill, the ministry wishes to respectively present the following observations and recommendations for consideration. I want the House to consider more accurately the titles of the bill that will reflect the objectives and contents of the bill after going through the bill. I'm suggesting something like Oyo State Reproductive Health, Prevention of Unsafe Abortion and Maternal Health Protection Bill 2025, or Oyo State Maternal Health Protection, Prevention and Unsafe Abortion and Reproductive Health Services Bill 2025, because these titles reflect emphasis on reproductive health, focus on the prevention of unsafe abortion, highlight maternal health protection, and are more politically and socially acceptable. The definition of unplanned pregnancy. If you look at unplanned pregnancy, anything we want to use, it's better to use unintended pregnancy. Unplanned pregnancy is part of unintended pregnancy. Unplanned pregnancy may be wanted later, but an unwanted pregnancy may never be wanted. So I want us to look at the definitions very well. In the section 2, the definition of a woman, the bill defines a woman as any female person of any age. But my recommendation will be woman means a female person of reproductive age, which includes a pregnant minor where applicable. Look at this section 2B also. One of the most critical omission in the bill is the absence of clearly defined gestational age limit, which the bill does not provide for here. The maximum gestational age limit, different limit under different circumstances, or emergency exception. I want also to look at the composition of the committee. The committee should be broader, and then the Nursing Council, representative of Oyo State Hospital Management Board, Oyo State Primary Care Board, health insurance, especially for people that could not be able to manage to pay for the services. Because this decision we are having involve clinical care, ethical care, maternal health, and health financing. I believe that committee powers may also be excessive because their function overlaps with some of the other ministries, like Hospital Management Board, Ministry of Health, Medical and Dental Council of Nigeria, Nursing and Midwifery Council, and so on and so forth. The facility also, the bill also provides inspection of facility. And I want a clarification on this, because the bill empowers the committee to pay periodic visits to registered health facilities. My concern is the frequency, scope, standard, and authority are not specified. Questions also arise as to funding, inspection, the standard, and so on and so forth. But when it comes to my own recommendation, reference should be made to national guidelines on legal termination of pregnancy that Oyo State just adopted. If you want this bill to be encompassing, we should make reference to that national guidelines. If you look at the national guideline, it's stated legal termination of pregnancy. Thank you very much. When you look at section 4, 16 institutional structures should be strengthened. And I want us also to look at the recommend when it comes to the reason for circumstances permitting termination. Risk to life, I have no objection, but physical or mental harm, likely to cause permanent physical or mental harm, is too subjective. And we must require certification by consultant obstetrician and gynecologist, psychiatrists, or if not available, any nursing, medical, midwives that are available. Then the question arises, when you have said that the patient is raped, what do you need evidence? What evidence is required? Police report, court order, medical evidence, or sworn affidavit? We should also look at this. Psychological distress provision requires clarification. The bill termination based on extreme psychological or mental health distress. This provision is broad and may be difficult. So, violence, pregnancy in a child below the age of consent, or other circumstances prescribed by the regulations. When you look at minor cases need a stronger child protection framework, and free treatment should be made available. And look at the clarification of offenses in section 10. I want us to clarify the offenses into severity, whether deliberately revealing a survivor identity to the media, very serious. Failure to report due to uncertainty, moderate. Administrative omission, lower. Intentionally intimidating a survivor is a very serious offense. And then punishment should reflect varying degree of culpability. That is my suggestion there. Then we must not duplicate the existing law. We must also revert to VAP law and look at the issue of fine up to maybe 2 million for severe cases and imprisonment of up to 5 years. Section 11 talk about conscientious objections and facility registration. And healthcare facilities shall ensure that the appropriate referral mechanism are available where a practitioner exercises lawful conscientious objection. We must look at that. Anybody, if the woman's life is at risk, I'm not expecting an health practitioner to refuse. But if you refuse, you must offer an immediate referral, and then there must be time limit here. Let me just jump to mandatory pre-abortion counseling in Section 13. Counseling shall be offered and strongly encouraged, even in pregnant emergencies. The woman must be given time to reflect. No duration is specified, and this could create unnecessary delays, particularly where gestational age limits apply. Recommendation: the reflection period shall not exceed 48 hours unless requested by the woman. And if you look at comprehensive sexual and reproductive education, it's potential conflict with cultural and religious sensitivity. That I want you to put it like this: comprehensive sexual and reproductive health and life skill education is better because it will respect cultural values, involve parents, involve faith-based organization, and follow approved national education curricula and confidentiality. And also, let me go to Section 17. It's a special provision for rural and undeserved community. Government shall ensure equitable access to termination of unplanned pregnancy. But please, government shall ensure equitable access to lawful reproductive health and post-abortion cases in services in accordance with existing law. Please, can we operate mobile and reproductive health clinic? It is not the question is that it is operationally difficult because what level of practitioner is involved, who will start them, referral pathway, community role of community health worker and extension also should be looked also into it. They must not be allowed to to perform abortion but can offer referral. The role also of others should be taken into consideration because some of them go to the medicine store, pharmacists, and so on and so forth. They should also be taken into consideration. Please, I will be discussing with the House, but let me tell you, the Ministry of Health supports a robust measure to protect survivors of rape, incest, and reproductive exploitation. Although, when you look at reproductive exploitation, it's not actually captured in the law, but they are there for you. Implementation must balance survivor protection, confidentiality, access to timely health care, and legal accountability. The ministry therefore recommends amendment to strengthen clarity, operational feasibility, and intersectoral collaboration. Thank you very much.
Thank you very much. I can't expect less. Let's put our hands together for the permanent secretary. Yes, they know all about abortion. They know all about unplanned pregnancy. Please, can we appreciate him more? Thank you so much. Thank you so much. Thank you so much. On the legal aspect of that bill, everything that has to do with do and don'ts of that bill. Yes, I would like to invite Barrister Oluwapumi, the Solicitor General and Permanent Secretary, Minister of Justice, for our presentation. You're welcome, Mommy.
Good morning, House.
Good morning, ma'am.
The Right Honorable Speaker in absentia, Honorable Adebo, all other honorable members of the House of Assembly are present, the permanent secretaries, and all other laws to be observed. From that's the chairman, House Committee on Health. From the Ministry of Justice, our review of the bill, just like the permanent secretary, Minister of Health, Dr. Ine, that the title of the bill should be changed to planned. We think it uses contraceptive, a method that is unplanned. But when it is unintended, it is critical because it seeks to acknowledge the realities of reproductive coercion, sexual violence, contraceptive failure, or changing socio-economic circumstances, pregnancy resulting from rape, incest, or reproductive exploitation, which are explicitly addressed in Section 51C and 51F of the proposed bill, are inherently unintended rather than merely unplanned. To describe a pregnancy resulting from a violent sexual assault as unplanned, minimize the trauma of the event for the survivor. This change will be applied consistently throughout the bill wherever the term unplanned pregnancy appears. The bill, when passed into law, will not operate in legal vacuum. Oyo State already has statutory and policy provisions relating to termination of pregnancy and reproductive health. We have section 228, 229, and 297 of the Criminal Code, Chapter 38, Volume 2, Laws of Oyo State. Section 228 to 230 and Section 297 in the state. Section 228 to 230 criminalize unlawful procurement of miscarriage, while Section 297 provides defense for surgical operations, including termination, carried out in good faith with reasonable care for the preservation of the mother's life. Section 16 of this law regulates the circumstances and procedure for determination of pregnancy. It is important to know that the issue with Section 16 is not that it duplicates the provision of this bill, but that it directly contradicts them. And as a result, we advise that Section 16 of the Oyo State Family Planning, Reproductive Health, and Maternity Services Law should be reviewed to prevent duplication. Then the Violence Against Women's Law 2017 and Violence Against Persons Prohibition Law 2020. Section 38(1) A to C and Section 39(1) A to C. Both laws respectively granted extensive rights for victims of violence, including access to comprehensive medical, psychological, social, and legal assistance, information, and rehabilitation. Both laws are directly relevant to circumstances contemplated by this bill, particularly cases of rape, incest, and reproductive exploitation, and should be expressly incorporated or cross-referenced. It is recommended that the provision be started to the following effect. I quote, where a pregnancy arises from rape, incest, or reproductive exploitation, the rights and entitlements of the victim under the Violence Against Women Law 2017 and the VAP Law 2020 shall apply and be enforceable in conjunction with the provisions of this law, and health facilities shall ensure that victims are informed of and afforded access to those rights. The standard and guidelines for medical management of gender-based violence survivors. The standard guidelines for medical management of gender-based survivors is the principal policy instrument in Oyo State concerning termination of pregnancy. In cases of gender-based violence, the document provides healthcare workers with holistic, step-by-step framework for addressing survivors' medical, psychological, legal, and social needs, with emphasis on the survivor-centered approach, prioritizing safety, confidentiality, respect, and non-discrimination. Dr. Aide also mentioned confidentiality of survivors, that the identity of such survivors should not be revealed. It is strongly recommended that the bill expressly recognize these standards and guidelines as a binding policy foundation and requires compliance by all healthcare facilities and providers rendering services under this law without this anchor. The bill risks creating a disconnect between the statutory framework and established practice in the state. Then on the issue of definition, the term healthcare provider, it is recommended that the bill introduce and define healthcare provider broadly to encompass medical practitioners, that is registered doctors, nurses and midwives, registered with Nursing and Midwifery Council of Nigeria, community health officers, and other regulated health professionals as appropriate to the specific provision in question. This broadens the operational scope of the bill for counseling, pre and post-abortion care, and community level services without compromising patient safety. Where the termination of pregnancy requires the involvement of a specialist nurse, the bill should expressly require that such specialists seek the advice or written consultation of a registered medical practitioner, that is a medical doctor, before proceeding. It is recommended that the provision be inserted to the following effects. Where the termination of a pregnancy is to be carried out by a specialist who is a nurse or a midwife, such specialist shall, prior to the procedure, obtain the advice or written consultation of a registered medical practitioner, and such consultation shall be documented in the patient's medical record. I remember that at the program that was held, he said even a phone call is as good as seeking medical advice rather than looking for a medical doctor wherever. Consent for termination, special provision for minors, victims of rape or incest. Section 7.4 of the bill requires the medical practitioner to ask a minor to consult with her parents, legal guardian, or a concerned citizen for consent before termination, pregnant as a result of rape or incest, particularly where the perpetrator is a parent or guardian, or the parent or guardian objects to the termination of the pregnancy or release.
Thank you very much, Ma, for that wonderful speech. We can appreciate a better place. Thank you so much. Thank you so much. You know, when we talk about this gender, we're very fragile. We need a lot of cares, and we're always victim of so many unbelievable acts in the society. And that is why we need to listen to this bill very well, everything that it entails, so that we can know our rights in the society. If at all we fall victims, we can know the right step to take. The government is ready to take good care of us. We have IGOs, we have other professional bodies that are ready to take good care of us, and that is why this gathering is very, very important. Before I call the next presenter to the microphone, I'll quickly appreciate the presence of some of our people here. The first person I would like to introduce to us is the Deputy Clerk, Legislative Matters, Research and Budget, Mrs. Ronke Ogudeji. You're welcome, ma'am. Thank you so much for joining us. Also, the representative of IPAS Nigeria Earth Foundation, Mrs. Doris Ikpebe. You're welcome. Thank you. The next person is the Women Advocate Research and Documentation Center, Dr. Mrs. Abiola Akiyode. Thank you so much. The next presentation will come from the Ministry of Women Affairs, the representative from the Ministry of Women Affairs. The representative from the Ministry of Women Affairs, okay, still on the way. All right, we can put our hands together for him. He's there. You're welcome, sir. Please, when we get to this place, let us mention our name. Let us introduce ourselves for documentation and news purposes. Thank you for coming, sir.
Let me start by taking doubles at the Chairman House Committee on the party. This, like it has been said, that we have just 3 minutes, to comment on this particular bill. From the Ministry of Women Affairs, I brought a kind of apology from my principals, the Honorable Commissioner, Honorable Mrs. Toyi Balogun, and the Permanent Secretary, Mrs. Oluwayemisi Roges. The two are on now. That is why the onus lies on me to represent and make our contributions to this particular event. We, from the ministry, and that is why we are of the concrete opinion that the program we are having today is a giant stride towards achieving, our desired goal. I'm not a lawyer. I can see the previous speakers, have been going through the pages by pages of the law, even including our guy from the Ministry of Health, who probably is a lawyer or is about becoming a lawyer after retirement. Our concern with with this particular bill is a bit different. Our concern is that we have agreed and we believe it's a giant stride towards solving the menace and challenges we are facing, particularly with the mandate that we are given in the Ministry of Women Affairs, which happens to do with the social challenges and problems and the vulnerable ones that we have in the society. Like a Yoruba adage will say, Amukun ẹrù ẹwọ, ó ní òkìlẹ̀ ń wò, ẹ wo ilẹ̀. If we are able to tame unplanned or unintended, whichever way, whatever is fundamental, pregnancy and unsafe abortion from our society, we believe that we will go a long way to reduce some of the impacts that or social impacts that you are having in the society, and that will help a lot our gesture for development in our society. We believe that this particular bill, we have gone through the pages, the 19 sections, clause by clause, and we believe it's just a starting point. Despite all challenges or the corrections that we might arise or resolution might arise from this particular city, it's a welcome bill, and we only want to draw our attentions to certain key things. One, as we mentioned, funding is very, very key, because without funding we cannot do anything. And when we go through the clauses of this bill, there is a need for the establishment of a committee that will give implementation to this bill. We are recommending and we are pleading that this committee should be funded. There should be clear-cut, funding apparatus for this particular committee, or otherwise, probably it's going to be another body that will be saddled with the responsibility of funding the implementation of this particular bill. I heard it being mentioned the other time that there is an agency called Sexual and Gender-Based Violence Referral Law, which has been passed into law. The dilly-dallying about the implementation of this law, if we had had this agency in place, probably it would have solved most of the 60% of the challenges that we envisage with this particular bill. My appeal is utmost response, so that we can now have all the needed frameworks, to tackle those menaces that we have envisaged from our end. Then again, I believe the implementation framework should be prepared alongside this particular law. Of each stakeholders, which should be clearly stated to avoid overlapping of functions. Then again, we want to reiterate that this bill, when passed into law, there should be enough sensitization, adequate sensitization and awareness by the public, so that if I run out of the law as a director who is here today, participating in this particular bill, then the law, I wouldn't give an excuse that I don't know what is in the law. Let's try as much as possible to sensitize every nook and crannies, in terms of Oyo State and all the people about this particular law. Like I've said, we want to reiterate again that this is a very good beginning. We are not saying that it doesn't have its flaws, but this is a very good beginning, particularly the problems and challenges of incest that is very, very rampant, and that is what we are experiencing now, a rape from our end. So I want to call on all the stakeholders that are present here today. Don't let us see this bill as maybe as another paper or document, but let's see it as another giant stride. It's another step towards solving problems within our society. So if we collectively aim and resolve, to build an empire, that would be good for us. So I believe that we will not want to be an emperor, particularly with the implementation of this particular bill when it becomes law. Once again, we thank you for giving us the opportunity. My name is Oguchibi Olutoye Dia. I'm the Director of Women Program, Ministry of Women Affairs and Social Inclusion. Thank you.
Thank you so much. So Ogutoye, Director of Women Affairs. Oguchimi, thank you so much. Even men advocate for women. I'm surprised, Ministry of Women Affairs, but we can see there's no ministry for men affairs. Even in my case. Please, let's put our hands together for some. All the women here, please let us appreciate ourselves. I'm happy that I'm one of you. If I come to this world many times, I will remain a woman. Thank you so much. I will quickly go through another list of the introduction. Please permit me, Mr. Chairman. I want to welcome again, and I want to introduce to us the Deputy Clerk, Editorial and General Services, Dr. Mrs. Olajimoke Olaribigbe. You are welcome, ma'am. Also, we have the next presenter, but our first introducer, and our envoy, Mrs. Oyiloye Biti, the Permanent Secretary, Ministry of Education. Thank you so much for coming. And with that, I'm inviting you to the microphone for your presentation, ma'am. You're welcome, and please let us appreciate her.
Morning, everyone. The speaker of the the chairman of the Committee on Health, all other members of this committee, all other honorable members of the House of Assembly, permanent secretaries, English ladies and gentlemen. I'm representing the Ministry of Education. We thank you for the opportunity given to us to go through the sections of this proposed bill. And according to our mandate at the Ministry of Education, then considering the age of those that are involved, that is between age probably 11 to 16, you agree that they are their tender ages, and what the really caption of this bill, it will not be such that we'll be encouraging them to have any kind of pregnancy because they are sure of having a safe abortion. That is why, having gone through the sections, starting from section 4, our mandate has been properly captured. Section 4, item F, that says comprehensive reproductive health knowledge. So that has been captured, that is secondary school age female students, even their counterpart as boys, they have a good knowledge of how their reproductive system works. They will learn that every action has a consequence, whether now or in the future. Then going to section 10, you also notice that a mandate has been captured again, that is protection against coerced silence. So to be incorporated in part of what we are to do that in their school system, when they have issues that has to do with sex, unwanted pregnancy, maybe need for abortion or whatsoever, you have somebody they can talk to, somebody they can trust and be sure that whatever information they are revealing to those people, that they are safe within their confines. Then finally, section 15, there we have detailed steps of what the bill will compose, and that is exactly what we need. And we have gone through, we have seen that everything has been properly captured. We have education on sexual abstinence. That is, this bill is not a license for them to indulge in anything and then hide under the plan that there's a bill for safe abortion. So we are going to still encourage the part of zip up, that abstinence still remains the best option of avoiding unplanned pregnancy. 2, they will be exposed to dangers of unsafe abortion, that it includes death. Then age-appropriate sex education, not just any sex education, that the classes they are, their age be considered in delivering this. Positive self-esteem, then the last one, their sexual rights and responsibilities. So based on these three sections, section 14 and 15, I want to say that Ministry of Education actively supports this bill. Thank you.
Thank you so much, Ma. That was a presentation by the Permanent Secretary, Minister of Education, on behalf of the Ministry. Thank you so much once again. Now, I want to call on the Executive Director, Plan Foundation, Mr. Batunde Oladapo, for his presentation. Please, let's put our hands together for him as a talk.
Thank you very much. I'm not very good at protocols, but I must recognize in absentia the Right Honorable Speaker of the Oyo State House of Assembly, my brother, Honorable Adebowale Ogundoyin, my very good brother, the Chairman of the House Committee on Health, my beautiful, very beautiful sister, the Chairman of the House Committee on Women Affairs, the Chairman of the House Committee on Education, Honorable Dalamin, thank you so much. Distinguished representatives of government ministries, departments and agencies, professional associations, development partners that are here, the Pamoja partners in Oyo State, just raise your hand. You're amazing. Whatsi, we thank you, Dr. Abiola Aboeji, my sister from IPAS, Madam Doris Ekeze, other partners here, my immediate family of persons with disabilities, we are amazing. Yes, thank you so much. Our spiritual fathers and mothers, the religious leaders that are here, you have opened up our eyes a lot when we had the discussions with you for 2 days. Things that people used to feel that religious leaders are opposition to something, things like this. We were really, really educated. The media, Shade, thank you. You'll be a professor of health media or something like that. Shade Ogutola, everybody knows that. Yeah. One day we'll have the opportunity of truly honoring you. My people from the ministries, I think the civil service in Oyo State is the doyen of civil service in Nigeria. I'm saying it proudly. That's why we say Ashiwaju Niwa, Ashiwaju Niwa. You can see the quality of recommendations and inputs. You understand? Thank you so much. We always get the best from Oyo State. And we appreciate your insightful contributions, Ma and Saz. Ladies and gentlemen, on behalf of Plan Foundation, Plan Health Advocacy and Development Foundation, I sincerely appreciate the Oyo State House of Assembly for not just for convening this public hearing, but making this house a fertile ground for us to flex our muscles, spread our wings in our desire to give a better life to our women and girls at the risk of no more unplanned, unintended pregnancy and unsafe abortion. This bill represents much more than legislation. It is an opportunity for your state to respond compassionately, responsibly and proactively to a major public health challenge that continues to claim the lives of women and girls and undermine the well-being of families and communities. Through Amplified Change, the Access project has been funded by Amplified Change. We have been able to work over the past 2 years to improve access to comprehensive sexuality education and sexual reproductive services in Oyo State. 2 projects, the Embassy project, targeting women with disabilities, and this particular project that is we're using to midwife this process. I am proud to say that it is not just about legislation. We are also generating evidence to support the legislation through the interventions we are having in some pilot schools in Oyo State to provide comprehensive sexuality education for our youngsters in secondary schools. I want to acknowledge the support, the outstanding support of the Ministry of Education, the Ministry of Health, and the Oyo State Primary Health Care Board for this intervention and still continue education. And the choice at that particular moment, speaking with her family, was that she was going to keep that pregnancy. She kept the pregnancy, she kept her education. That is what we are talking about. So, as part of this process, we have facilitated policy dialogues right from the conception when we are writing the proposal. And that is why I will have to thank my brother, the chairman of the High School House Committee on Health. They have been with us from the conception of this project, even before we got the funding. When we are not even sure that we are going to get the funding. And I want to acknowledge Mr. Olai too. He has been our engine room, our technical advisor, every stage. The Ministry of Justice too. And we've had situations in which we've had legal drafting sessions. We've carried out advocacy meetings. I want to also acknowledge the clerk of the House for the very receptive environment that they have given us. They've also helped us a lot in reviewing some of these drafts. And we held a meeting where we were shocked, pleasantly shocked at the level of support that we see from the House of Assembly. We've also have consultations, capacity building sessions that inform this bill. So what we brought today, we're talking about today, was a lot, came from a lot of painstaking work. And I can say that I am happy that we're having this public hearing today. When you do work and you are so proud of yourself, and some people begin to tear it to pieces and pick and this, and you say, wow. Even despite the fact that I've done so much, there is still a lot more to do. And I want to promise the House that we will work to support the process of sitting down together again, like we did that time at Honorable Comforter when we were in Lagos, to look at all these inputs and consider them in bringing out something that Oyo State will continue to be proud of. So this bill promotes comprehensive specialty education, like I said, and issues around post-abortion care, psychosocial support, and all the things that my brother, Mr. Olayanju, has highlighted. So we want to urge the honorable members of the House to seize this historic opportunity, and I know it is a baby of the House, by giving favorable consideration to this bill. It is your bill. When we started the project, we felt that this should be a House member bill because you are the true representatives of the people of Oyo State. You know your people, you know what the problems are. We are just mere facilitators in this whole process, and we believe it is your bill. If we now begin to urge you to give it favorable consideration, it's like trying to preach to the already converted. I am so proud that I'm from Oyo State. I'm so proud that we have a House that is responsive to the needs of the people of Oyo State. Now, one thing we want to also do, we are also looking forward to the opportunity of establishing GBV and sexual and reproductive health in all ministries across the state. And I'll give you one of the reasons. For example, if you are bringing budget, people they'll be talking about money, how do we fund this? If you come to the Ministry of Finance, but when you have somebody that is gender sensitive, that is SRA, sexual and reproductive sensitive, in the Ministry of Finance and Budget and Planning, they will understand where we have to put these things in the budget. And Plan Foundation is working on a project that will support all these things, mainstreaming all these things into all our public life, so that we will see the reason why we need to put money into this. And I always say, when we have these wonderful laws and we don't put in place the enabling environment, the enabling funding to implement, it's like just putting pieces of paper on the shelf. And your state, it would not be like this. So one thing I also want to contribute to this, from what I've heard today, is that we must ensure, just especially from the presentation from the Ministry of Justice, that we need to work on establishing linkages with existing structures that support the provisions of the bill. And I want to say, on behalf of our funders, that Plan Foundation will continue to support the processes of ensuring that we have achieve sustainability for whatever we are doing in respect of this bill. Our work, our support is not ending with the passage of the bill into law. And we will continue to support our state towards making life better for our people. I want to thank you. God bless you.
Thank you so much, sir. Please, we can do better. They're actually the sponsor of this bill. They've been working hand in hand with the Oyo State House of Assembly. And you can see from his presentation. Now, I want to invite from the religious body, Christian Association of Nigeria, CAN, the representative should come out for the presentation. CAN? The CAN representative, anybody from the CAN, Christian Association of Nigeria? All right, I just got to know now that the religious body has a joint presentation. Please, the representative of that body should come. Body. I need to remind us that we have our documentations here, and we're going to go through it. Any presentation should not be on 3 minutes, please. 3 minutes, so that, because we have a lot on our list, please.
First and foremost, Sallu ala Nabi Kareem. Allahumma salli ala Muhammadi wa ala ali Muhammadi wa sallim. Followed by our normal greeting, Assalamu alaikum wa rahmatullahi wa barakatuh. The name is Al-Hajj Chief Salahuddin Hussein, Director General, World Islamic Peace Foundation, and Chief Imam Ajima for Hussein Central Mosque. We are representing the entire Muslim in Oyo State, and by extension in Nigeria, by virtue of the Supreme Council for Islamic Affairs. And I happen to be the Secretary General in Oyo State. So the issue is highly welcome that we are having this type of developments in our country, because we have been noticing, we Muslims have been noticing the way the citizenry have been going about their daily living, especially when it comes to reproductive health. Imagine what we've been experiencing regarding the coming up of a family planning campaign. Young girls getting pregnant randomly. Even some women, married women, indefatigable brother, the prince of all princes, Prince Obadapo or Ladapo, may you live long. So we've been saying it, and today we confirm and we affirm that the Muslims are totally in support of this new development, one way or the other, especially when it comes to domestic issues, misinterpretation of Islam, misinformation about Islam. So this is whereby the public promulgation of a law is highly relevant. So we are expecting deep deliberation on it and quick ratification and confirmation by the executive governor. May the Almighty bless.
Now is the turn of Christian Association of Nigeria. Your name, please.
I am Dr. Olatunde Oladoyibo. I'm both a doctor and a preacher. And unfortunately, I didn't have access we want to do everything possible to preserve the lives of our people. But I always believe that prevention is better than cure. Unfortunately, because of the dysfunction in our society, happening is a good beginning. But I should say that we need some radical thinking. I'm happy that the Ministry of Education PS is here. I'm just thinking that a girl gets pregnant should not mean she should get out of school. We have to be it's something that we should think through. One of the challenges when people want to go get abortion is you don't want anything to disturb your education, you don't want social stigma. We need a reorientation. Okay, it's done, continue with education. You can get your baby and still continue with school. When we do that, it might be difficult to begin with, but it's going to reduce the need for abortion. I have practiced in the last 42 years in the rural areas. What we are saying, safe places, there is nothing called safe abortion. Quote me. Even in the rural areas, you don't have the personnel. We don't have the institution. So our focus should be, let it not happen. And when it happens, work with it. You say, let them have the babies. If they don't want the babies, they can be given for adoption. We must learn from experience of other lands, the US, the UK. In actual fact, some of the people that were encouraged to have abortion in the 60s and 70s, in their old age, one of them sued the UK government for a bill has input in it, psychological counseling, and all of that. It goes beyond just removing the baby. It goes beyond. We have to do everything possible. And in our society that is largely religious, and that's good for us. I don't want us to leave our religiosity. It stabilizes the society. I recall it took them, the US, 50 years to overcome this kind of a law that gives access. The first year that this kind of a law was pronounced in New York City alone, 1 million abortions were committed. Look, here we don't have the personnel. The pressure on the healthcare system is heavy. And I think the Women Affairs Ministry and other groups should work on the family setting and the school system. Yes, Eric. Late, so you see, we must work at prevention. I also observe that we are talking about women affairs, women. You must reach the men. Women don't get pregnant by themselves. Think about it. And I am sad that even some of our men, when they have parties, they recruit young girls. You see, there are many things in our society that we must not deceive ourselves. Our honorables, I'm happy that you're here. I've been at a party of an honorable that I saw them recruit young girls to come and service the men. Look, beyond the papers, the society needs overhaul, a moral rebirth. A moral rebirth. We must put on this so that, look, the population of our youngsters in school, they are very many. And people are committing abortion in corner shops. If that will not happen, oversight functions, Ministry of Health, visit, enforce. We support this because ultimately it will shield our future. But again, from my experience of funding, House of Assembly, I refer to Funding is critical. When organizations from abroad help us to put this together and we are packaging it together, how do we move it forward on our own? We don't need to depend on development partners before we do what is convenient for our own people. It must be that it is this program, when it is done, let's provide the funds. Education for the people, through mosques, through markets, through schools, especially. The story can be different, and in 10 years now we can look back and thank God that Plan and the House of Assembly did something that is worth clapping for. Thank you.
Thank you so much. so much. That was a presentation from the Christian Association of Nigeria. And the next presentation now will come from the Women Advocate Research and Development Center. The representative, please, move forward for your presentation. And we appreciate how she's coming.
Thank you very much, Ma. Distinguished honorables present, I greet you. My dear brother, Dr. Obatunde Oladapo, Honorable Commissioner present. My sister is here. We were classmates. My learned friend, my sister, Ms. Oluwabumi, I recognize you. Thank you very much, and thanks for what you do. So, ladies and gentlemen, I'm the founder of Women Advocates Research and Documentation Center. And our work is primarily around policy advocacy. We have our national office in Lagos, but we work across Nigeria. So I'm very delighted to partner with PLAN. We're delighted to partner with PLAN on this event today. Let me also say that we want to also commiserate with the state, particularly for what is happening at Okomosho. We will continue to pray that the children will return back safely, and every other person that are in the pen of the bandits will be back as soon as possible. Thank you so much. So, with respect to the summit, we submit a memorandum in strong support of the Oyo State Unplanned Pregnancy and Unsafe Prevention Bill. We believe that the legislation represents a very landmark opportunity, and Oyo State is going to be the first to take that bold step in Nigeria. We are very aware, thank you very much, sir. We are very aware of the data that is coming out of Nigeria. With respect to maternal mortality, Nigeria is second to India. And majority of the deaths of women during pregnancy is as a result of unsafe abortion. So taking this step will save a lot of young girls, will save a lot of women. We believe that the bill is addressing persistent inequality and social marginalization. We know that there are constitutional protection for women, girls, and vulnerable people. And we're also happy that the bill is also looking at issues of rural women. On the side of the definition section, the bill adequately captures a broad spectrum of issues. And I know that the Permanent Secretary for Health, Permanent Secretary for Justice, had actually addressed some areas that the bill definition needs to be amended. We are in alignment with some of the things. And this bill will save lives. There are very strong key points in the bill. I don't want to speak a lot because of time. And I think one of the key areas is that the bill is protecting the most vulnerable people against rape, incest, and exploitation. Bringing words like exploitation into the bill, it's very innovative, and I think I must commend that it's also very progressive. And it's going to provide a legal pathway. We are part of those who work on VAT law at the national level and also at state levels. And we know that there is a gap in the VAT law in terms of the legal pathway to comprehensive sexual support. We believe that this bill will go a long way in addressing those hurdles that we continue to face when there are circumstances of rape, incest, and other forms of unplanned or unintentional pregnancy. We also believe that it will address health equity and access for undeserved community. The prevention aspect is one of the most important aspects. I'm sure we don't all want to see unbridled abortion. What we want to see is more of prevention. And if you look at the area where the bill is talking about prevention, it's very, very elaborate. It is very, very elaborate. To the extent that if it is pursued. Maybe in some years back, there will probably no need to discuss much about unsafe abortion. And I think that is where we want to get to. It is not promoting abortion, but rather saying we need to save lives. And that's the reality of today. Data has shown people are dying on a daily basis. Your state is not an exception. I want to congratulate the House of Assembly for taking this bold step. And I want to say, we do hope that this becomes the first, because I am also aware that Bauchi State.
Thank you so much. Congratulations to all of us at your states. While she was delivering a message to us, we have the number one citizen, number one civil servant, the legislative arm of the Peseta State. The clerk of your state, House of Assembly, Barrister Mrs. Adenike Taiwo Muranatola. You are welcome, ma'am. Thank you. Please, let's put our hands together for this wonderful woman. She is doing a lot in Oyo State House of Assembly. Please, can we jam our hands together for her once again? Thank you so much. Out of your tight schedule, you still make sure you are here. You are welcome, ma'am. Thank you so much. We have the next presentation from Nigeria Medical Association, NNA, the representative of Nigeria Medical Association. Are we here? Okay. Okay. National Association of Nigerian Nurses and Midwives, the representative from the National Association of Nigerian Nurses and Midwives. All right, let's move to. Okay, someone is coming. All right. And then the representative from the International Federation of Women Lawyers, FIDA, she will please get ready after this presentation. Please, can we encourage him as he's approaching the microphone? You're welcome, sir. Your name first, where you represent, second.
Good afternoon. Chairman, House Committee on Health, Honorable Dagamosi, aka Canada, Honorable Alani, I recognize you, other honorable members of the House present. I recognize you all. Commissioners here present, the permanent secretaries, the directors, all other stakeholders here present, and the dignitaries. I'm Adeleke Olugbade Victor, Chairman, National Association of Nigerian Nurses and Midwives, Oyo State Council. Firstly, let me say this by appreciating the 10th House of Assembly bringing this up, this time in the society when we have much of maternal death, secondary to unsafe abortion. One, I begin to think of the psychosocial consequences of pregnancy emanating from unsafe termination of pregnancies. One, we have secondary infertility, we have financial extortion, we have single parenting when there is unplanned pregnancy, poverty, stigma, discrimination, psychological trauma, etc. So bringing this up this time around is timely, and from the association and by able representation of all nurses in the state, and even the federal health institutions in the state, we are totally in support of this bill to come to fruition. Let me quickly appreciate again the principal sponsor and other honorables in support of this bill, that God will help us to have a remarkable success in Jesus' name. From the association, as we have appreciated this opportunity to contribute to the legislative process, are the foremost professional body representing nurses and midwives in Oyo State. we have a vital interest in ensuring that laws governing unintended pregnancies and unsafe abortions promote the health, safety, dignity, and well-being of women and girls while safeguarding professional standards and ethical practice. Pursuant to your request, the association has conducted a thorough review of the proposed bill, following extensive consultations with our members and relevant stakeholders across the state. We hereby submit as follows. The following observations and recommendations for the consideration of the House Committee on Health. Observations and recommendations. Section 3.2. Composition of the committee. The National Association of Nigerian Nurses and Midwives, Oyo State Council, acknowledge the efforts of the Oyo State government in establishing a committee to address the critical issues of unplanned pregnancies and unsafe abortions through the proposed bill. However, the association observes that the composition of the proposed committee is heavily weighted towards one professional group with a predominance of medical practitioners. While we recognize and appreciate the indispensable role of medical practitioners in maternal and reproductive health care, we respectively note that there is currently no provision for the representation of registered nurse midwives in the committee. Midwives are trained healthcare professionals who specialize in the care of women during pregnancy, labor, childbirth, and the postpartum period, while also providing essential newborn care and reproductive health services. They are often the primary point of contact for women seeking maternal and reproductive health care, particularly at the primary health care level and in rural communities. Given their critical role and extensive experience in maternal and newborn health, the exclusion of midwives from the committee creates a significant gap in the multidisciplinary approach required to effectively address the complex issues surrounding unplanned pregnancies and unsafe abortion. Furthermore, the association observed that neither the Ministry of Education nor the Nigerian Police Force is represented on the proposed committee. Considering that a significant proportion of unplanned pregnancies occur among adolescents and young people of school age, the inclusion of the Ministry of Education is essential to achieving the objectives of the bill. The representation from the ministry will facilitate the integration of age-appropriate, evidence-based, comprehensive sexuality and reproductive health education into schools across the state and ensure the effective implementation of relevant policies and programs. Similarly, the inclusion of a representative nominated by the Commissioner of Police is necessary to strengthen coordination between healthcare providers, social welfare agencies, and law enforcement authorities. This will enhance the investigation and prosecution of offences arising under the proposed law, including rape, sexual abuse, coercion, exploitation, and other forms of gender-based violence. Recommendation. The association therefore recommends that Section 3.2 be amended to include at least one registered nurse midwife with relevant expertise in maternal and reproductive health. 2. A representative of the National Association of Nigerian Nurses and Midwives, NAM, Oyo State Council. The inclusion of these stakeholders will ensure a more holistic, balanced, multidisciplinary, and intersectoral committee structure that reflects the realities of healthcare delivery in Oyo State. Such representation will strengthen the committee's deliberations by incorporating the perspectives of nursing, medicine, education, and law enforcement, ultimately leading to more comprehensive and effective policy outcomes. The success of this important legislative initiative will depend significantly on ensuring that all key stakeholders are adequately represented. Section 8. Mandatory reporting of rape and sexual abuse cases. The association commends the inclusion of Section 8 of the bill, which provides intervention and ensuring access to appropriate medical, psychosocial, and legal support services. However, while the section clearly outlines obligation to report such incidents, It does not adequately specify the legal consequences for perpetrators of rape and sexual abuse. Recommendation. The association recommends that Section 8 be expanded to expressly provide that any person found guilty of rape or sexual abuse shall be subjected to the penalties prescribed under the relevant laws of Oyo State. Clearly defined punitive measures will serve as a deterrent, strengthen accountability, and reinforce the state's commitment to protecting survivors and preventing sexual violence. Furthermore, aligning the bill with the existing laws on sexual offences and child protection will prevent duplication and ensure consistency within the legal framework. This addition will enhance the effectiveness of the legislation by ensuring that mandatory reporting is accompanied by clear legal consequences for offenders. The National Association of Nigerian Nurses and Midwives, Oyo State Council, remains committed to supporting initiatives aimed at reducing maternal morbidity and mortality, and improving reproductive health outcomes in the state. We appreciate the opportunity to contribute to this important legislative process and remain available to provide further clarification or participate in subsequent stakeholders' engagements as may be required. Thank you for the opportunity.
Thank you so much, sir. Please, when we come here, we are expected to just give the summary of what our presentation, our document represents. The summary in few words, in few sentences. Please, we're not here to start reading the whole memorandum, please. To save our time, we still have a very long list. International Federation of Women Lawyers, the representative. Are we here? Okay, the civil society. The civil society, the representative. Okay, International Development Partner, WHO. UNICEF, any representative. Are we here? Please, we can wave our hand if we're here so that we'll know we're on the way. All right, you're welcome to the microphone, ma'am. Please, let's join our hands together for. The lights hub for the Blind Empowerment Foundation should get set. Please, you can move nearer.
Permit me to stand on the existing protocol. I am from WHO representing my state coordinator who is unavoidably absent, the person of Dr. Zoto Philip. I want to tell us that WHO supports all the agenda of Oyo State because we are supporting partners, and in respect to this issue that has to do with intended pregnancy and unsafe abortion, I want to tell you that WHO is fully in support. We can give our technical guidelines as to the issue. But I have some concern, and my concern is this. After going through the memorandum, listening to everybody talking today, I want to talk about if we can have a youth-friendly clinic in our health facilities where our adolescents can be educated on issues like this, that borders on intended pregnancy and family planning. And also, how do we reach the vulnerable populations, like the one at the border LGAs in Oyo State? I can remember traveling to Urologbe. There's a community in the bush there called Soro, and that community has no health facility. And if there is a case of abortion, how will they assess post-abortive cares? And thirdly, I love what Oyo State have done by ensuring that medical practitioners are in check. And we're talking about consistency of this implementation of the bills, and also the sustainability when it comes to funding to ensure that all our children, all our girls are protected. Thank you very much.
Thank you so much. I trust my gender, yes. Another person is coming, yes, my gender, I trust her. She will take just a little time. The civil society, you're welcome, your name, ma'am. Women, please let us appreciate ourselves. Yes, we hold the world.
I hereby adopting an existing protocol. I'm Dr. Bola Omidi. the representative of civil society. From the experience from field work and civil society, we civil society are in support of this bill. The reason is, when we look at it from spiritual, religious, and moral angle, people think it's not good. But for maternal mortality rate reduction, the bill is good. And that will even help us to go far to deep down to the community to advocate for them. Gone are the days that we preach abstinence, fine. But these days, is it happening? Let us face reality and make sure we work towards it to save our younger ones and our society to develop. Thank you.
Thank you, ma. Please, can we appreciate her? Can we please? Okay, the National Council for Women Society. You're welcome, ma. Your name, ma?
My name is Peter Olufemilayo Olila. National Council of Women Society for your state. This is our submission. We as the council, we fully appreciate this bold step taken by the House of Assembly, and we are in support of this as well. So we have some recommendations to make for this program, and these are our recommendations. We want amendment in clauses 3 and 5. That is under and evidence-based sexually subsidized contraceptions to all public health centers across Oyo State in all the 33 local government councils. And we want you to supply chain accountability to prevent stock out of family planning commodities in all these councils as well. Under safety and access, we want to form document all public registered and compassionate ears in all areas. We want amendment in clause